Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
Welcome to the show, everybody. This week, we're going to be talking about mind-body therapy, and we have a very special guest today. Samantha Haynes is here with us, and Dr. Richard Schulman.
Hey, everybody. Full transparency, Samantha is the amazing body therapist that I work with. We do our mind-body stuff. Hey, Samantha, how you doing today?
I'm good, Richard. How are you?
Excellent. You know, I think it'd be good for people to know how this thing all got started. So you're a massage therapist, but you're not like just a massage therapist, are you?
No.
I mean, you do all kinds of cool stuff. What else do you do besides, you know, sort of the regular massage?
Well, I try not to do anything regular. I've always
well, then you're the perfect partner
off
for me.
the beaten path with everything I get my hands into. But I started massage school a little over 20 years ago, and I left saying that I was gonna, you know, make change and be this great structural therapist, and I wasn't into woo-woo stuff and all of that. Like we're gonna make structure change, and it's all in the physical. And the more that I worked in my practice, the more I understood doing that neuromuscular work, the more I started to understand that people's psyches had a lot to do with how well they dealt with what I was doing. And so sometimes when I was working in someone's mouth, even though that was protocol, they would end up in more pain because they had so much anxiety about where I was going and what I was doing. So I started.
By working in someone's mouth, what do you mean by that? Because wouldn't it be cramped quarters?
So yeah, it's cramped quarters, like somebody who has TMJ, like mandibular joint syndrome, like they get headaches from the day. And so I would be doing intraoral work, and that's when I realized that like people were uncomfortable with certain parts of massage therapy. And I moved into some more subtle therapies. I got into lymphatic drainage, which has a lot to do with the emotional body. And I started to study emotional holding patterns, which is basically where it talks about we're all hardwired the same, you know, we're all kind of the same basic computer. And anytime I experience fear, my shoulders go up to my ears. Anytime you experience fear, your shoulders come up to our ears. So we all have the same hardwiring, and each emotion has a different knee-jerk reaction in our body. But I experience fear differently than you experience fear, differently than, let's say, the woman who lives in fear of her husband her whole entire life. And you see this woman who, even when she's smiling at you, her, oh, hi, honey, nice to meet you. And, you know, her ears, or her shoulders, they live up by her ears. And so I started to use that in my practice, understanding how people's emotional state can create a muscular dysfunction over time. Enter in the lymphatic work, and as I start to release those, I start to feel the fluid move. So not only do we get our muscles stuck, but we get fluid trapped in there. The fluid is the vessel for all of our hormones to be carried. Hormones are our emotions on a chemical level. So we would get all these emotional releases when I was doing the lymphatic work. And then
what does that look like at that point? Like you've got someone on your table, they've been trapping this energy and chemical messengers, and it's being stored in lymph, and I'm assuming also in the muscle tissue itself.
Absolutely.
What does it look like? What did you keep seeing as a pattern? Like, are people crying inexplicably when they're on the table?
Sometimes people would have emotional releases. They would have emotions come up and they didn't understand why. Sometimes they would have pictures come into their head. Sometimes they would go back to a trauma. I have, you know, when you do lymphatic work, your lower lymph ducts are in your, it's right above the pelvic region. And so when you put your hands there, it's a very vulnerable and sensitive place for some people. I've uncovered sexual abuse. I've uncovered all sorts of things. People also hold at their diaphragm here a lot of emotion. Our breath has a lot to do with it. And there's a little bundle of vessels in there as well that lead to our deep lymphatic. So, you know, on a emotional level, you know, we're holding air and we're holding things tight, but not only that, but when we hold those muscles tight, it clamps down on those vessels, and they're tiny. So fluid can't flow freely through, and your lymphatic can't go to the deep place where it makes it out of the body. This is why our digestion and our emotions are so linked, because 50% of your lymphatic system runs along your digestive system. We block at the solar plexus and nothing can come out. So I started out in digestion and it really moved into emotion.
And then
you were kind of doing this on your own for a while before we met.
Yeah, I've been doing lymphatic work for 15 years. And I started to put the pieces of the puzzle together about a year into my lymphatic work. And then that's what made me start to study the emotional holding patterns, because I would find fluid pockets in different parts of the body and then emotions that would come out. So trying to understand how someone holds that and what emotion that's related to. And even deeper than that, I know a lot of people out there have heard of Louise Hay, Heal Your Body, Heal Your Life. I cross-reference her book with another one called Messages from the Body. And it comes back, a lot of people think it's really woo-woo, but it all comes back to that hormonal release. And, these chemicals, getting too many or not enough of certain things will create actual disease in our body. And
sure.
So book.
Well, remember what Arthur C. Clarke said, any sufficiently advanced technology is indistinguishable from magic. Of course it looked like woo-woo. You were getting results when other people weren't.
Yeah, and I'm a person I'm into the woo-woo, but I always think that there's a scientific explanation for the woo-woo too. Something has to make it work. So in the beginning of this book, this man starts to talk about, one thing that kept coming across my table was Parkinson's. And in this book, they relate Parkinson's to gripping control. And if you look into Parkinson's, it's a lack of serotonin in the brain that starts to create some deterioration. And so if you have this thing in you that has to have gripping control, how are you ever going to find joy? How's your brain ever going to secrete serotonin? So that's where the woo-woo comes down to the scientific level for me. I always try and find how it really works in the world too.
So my impression of you, though, is that you embrace the mystery as well.
Oh, I usually embrace the mystery first, and then I want to figure out how it works. So I'm one of the biggest skeptics, but when I see something work and I know it works, or I feel it work, which is what I do in my profession, I feel it work. I feel the shifts on the table, not just on an energetic level, but I can feel the body let go at the same time as I feel the energy. So then I'm like, why? And that's where my brain wants to dig into the science.
Yeah, and I can relate to that. I'm right there with you, Samantha. So take me back. You've got lymphatic drainage. You're putting your hands on a patient or a client. You're massaging out this lymph, emotional containing fluid. I mean, let's just maybe call it popping the emotional zick. And why isn't it creepy when you've got a psychologist there in the room with you? What exactly is his role? And how is it relevant? If you pop an emotional zit and someone starts crying uncontrollable, is he sort of there to help talk them off the ledge? Or how do our listeners understand the amalgam of the two of you to be more than the sum of either of your parts? Because it's really quite amazing what you do.
Well, so what we usually do is when we start a session, I tune in and just kind of really get into their energy field. And Richard will give me like a 30-second rundown. I don't want him to go too deep, but I don't want to be grabbing it in the dark either. So I want just a tiny bit of information about what's going on around their trauma. And then when he starts talking about it, I start to watch their body move. Sometimes their feet will start to do this, or one or the other. You can tell if it's feminine or masculine depending on which foot is moving. I watch how their shoulders move, how they start to guard themselves. A lot of times, and I'll just stand, a lot of times people's hands go right here. And that kind of gives me cues of where I need to go and ground them or put my hands. Then when we really start to get into core stuff, I get my hands in their abdomen. When he hits a real core issue, I feel the fluid release.
Yeah, and
so vice versa.
I dialogue with the patient so Sam can focus completely on the body. Mm-hmm. Now, that doesn't mean that she doesn't have anything to say. Somehow, I don't know how the hell she did it, she captured my model like about 30 seconds after we started our first patient. Actually, she had it before. I didn't realize that she already knew the way that I was thinking about things. And the reason I think this is so powerful is because mind, body, heart, spirit, they get encoded all at the same instant. It doesn't make any sense to me, for Sam to work on the body and then send a patient to me 2 days later. It's such a powerful,
essentially, which is what I've been doing essentially for the past 10 years with a different therapist. So my practice has been in an office. I've shared a space for about 12 years with a psychotherapist, that I would open up all of these things and then I would send him down the hall to Wade. But we didn't really have connection. And when Richards and I stepped in together, it was like the whole piece of the puzzle. Like, we can affect them real time. I can feel what's going on while he's talking about the emotion, and I can pinpoint it right then.
You know, when you get something in real time, it's incredibly powerful. There used to be a TV show called Candid Camera. You catch a person in the act of being themselves. They get immediate feedback and immediate comfort if they need it. The other advantage for me is that they have mom and dad in the room, and we actually like each other, so we're not fighting, that can be very healing for a patient who's had a lot of early family issues. Also just having somebody like Sam who's so healing, to have her just put her hand on somebody, a gentle, kind touch, is an amazingly powerful event for some people.
And it's something that Rich, you and I are not allowed to do.
Yeah.
Much less in any therapeutic way. So it's bringing in this whole other aspect as part of this emotional shifting process, really.
Especially when you're working with someone who didn't have parents that held space for them. And it's really hard for them to enter into the space of being vulnerable, because usually that person has a pattern of choosing someone who still doesn't hold space for them. So to have me like literally hands on them, holding them while he's talking with them, sometimes people go all the way back to childhood and they just break wide open. And just to have hands hang on to you in that process. I worked with someone on my own today, and just having, her knowing that somebody had her, it was a big deal. It was the breaking point of our session.
That's fascinating.
I've been doing this a long time, and I'm still amazed, the kind of breakthroughs we get. And, Sam is as good as it gets. She's really so intuitive. That's the other thing. Would you want to comment on how you use your intuition in this process?
Yeah, that's
this
not
isn't just scientific,
No, and it's not part of your customary training as a massage therapist.
It's not. And it's something that, it's something that I always had underneath. Like when I was massaging more, my clients would often say, "How did you know it was there?" Or it'd be outside of my protocol, my normal, and then all of a sudden I would just feel that my hands needed to go in this direction or into this direction. And so I always had an intuition about where it was in the body. And then I started to receive information about people. And
like inexplicably.
Things that I didn't know how I would know. And I kept quiet about it for a really long time. And maybe in the last 4 years have, with some of my longtime clients, I'll share things. And I had a session with a friend of mine about a year ago, and she's an energetic healer as well. She's been a huge mentor for me. And something was shifting. I just come back from Italy, and I was really finding a powerful place. And she could feel something moving. So she did this, her words to me were, "There's an ancestral piece that needs to move." And it was crazy because my father came in on that session, and I 180'd on the table, and these gifts just really opened wide. And I want to say within 2 months, I wandered into Richard's office for a completely different reason. First time we met, and I knew when I sat down on the couch, I'm like, there's a bigger reason that I'm here for what I'm technically here for right now. And
I felt the same thing. I said, here, read my book, see if you like it. I think we might work together, you know. And boy, I'm so glad. The intuitive piece, when I'm working with Sam, I trust that she's going to give me information that I can translate into the patient's language. That's part of my job. She picks up a lot of really interesting information, but it has to be done in the patient's model of the universe. And you know, like I said, she picked up my model so fast, it was eerie. The bottom line is, we'll work together on it. Mm-hmm. You know, I can ask her questions. We can have a conversation in front of the patient that can be a debate that's already in the patient's head. Mm-hmm. We can really just kind of helping the person on the table to reveal themselves to themselves. So they kind of meet themselves in a way. Mm-hmm. It's really kind of cool. I mean, that's the bottom line.
There was no learning curve.
Really cool.
There was no learning curve. It just, we entered in, I referred him someone that I was having a hard time getting through to, and he called me in on that because it was somebody he was having a hard time getting through to on his own as well. And we came together with this teenage girl, and it was like breathing. There was no learning curve. We just knew what to do with each other. So it really feels very divine to me.
Yeah, it really, and it was one of those things where I didn't have a body therapist at that point to work with. And I was kind of wondering if I was ever going to find somebody to work with again. And then, you know, somebody fantastic just said, oh, hello. And it was really an amazing event. What are the hardest kind of patients for you, Sam? That was a curveball, I guess.
I don't think that there's hard patients, because I guess maybe the more difficult in societal terms, the more interesting it is for me.
Oh, okay. Well, that actually explains a few things. Because the first body therapist I ever worked with John Upledger, and she said to me, how come your patients are so much harder than the ones at the Institute? I said, well, the Institute patients are physically compromised. But most of them are emotionally, you know, fairly robust. Dealing with psych patients is a whole other,
it's a whole other
kettle of fish, so to speak, because you really have to understand that you can be an incredible body therapist and really good at the psychology, but there are a few tricks that we learned in psychotherapy school so that you don't lose the patient. So anyway, I was just wondering if you had thoughts on that. What do you like the best about doing this?
My favorite thing about doing this is, I mean, obviously I got into wellness and the healing arts to create change and to make people better. And I've been saying for many years that I'm bailing water with a spoon, working on one person at a time, doing massage. I feel like a Band-Aid and I need to move. Which is, you know, why you wandered into my world or why I wandered into yours. But the thing that I like best about what we're doing together is when you facilitate change in the way that we're facilitating change, you affect everyone around them. You're not just working with one person. I am, by changing the way that somebody views the world and the way that somebody moves in the world, it makes their parents' lives better. It makes their children's lives better. It makes everyone that they work with better. It just makes, it radiates out so much further than just fixing somebody's pulled muscle. And that, not to discredit that, I have a team of people to do that for me now. But I can just facilitate so much more change on a greater level doing the work that we're doing, and that's what I'm here for.
Cool. Well, that's the reason for, you know, I was given the message, I had to leave the world a better place than I found it. And, you know, usually I make a mess, but hopefully with this, I can do some of that. And Mark, Dr. Sylvester, is one of the few physicians, one of the few psychiatrists that really understands this work. And he's been incredibly supportive of it. Thank you, Mark.
Oh, my pleasure. And, you know, I'm just sitting, I don't know if it shows me the whole time, but I'm like this whole time listening to all this, because it's sort of like discovering a new field of therapy, a new field of medicine, a new field of healing, really. And once you've discovered that, once you've accessed, you know, deep emotional trauma and heal it, you have the ability to heal it. Once you're able to do that, you realize the size and the scale of the ineptitude of what we've been missing. You know, how many more people could we have helped? And then looking to the future, helping all those people, or more importantly, saying, well, that was neat 1 or 2 times. This needs to be its own, you know, well-recognized field of mind-body therapy, because it's more than the sum of its parts. And it's an absolute pleasure to talk to you about this and to learn about this and have our listeners hear and understand exactly what this is and how it works, so that they know when it's applicable to them. If they have very serious locked in traumas, whether they're childhood traumas or a recent trauma, or even, you know, more modern breakup traumas, divorce, more subtle, I guess, in terms of the whole energy bodies and the memory of this. It has utility across all domains of therapy, which I find just absolutely fascinating.
Well, it's also fun.
It is fun.
And it's fun.
I think of it as hard fun. I mean, we're working really hard, but it's the idea of being in that energy and trying to figure out how to get past the defensive structures is really it. I don't challenge is what people would say, but I find it fun. But it's hard fun. It takes a lot of focus.
Mm-hmm.
You know, I've seen you really focus. You're like, I don't know how you do it sometimes.
I've got a fun question. Because you both know me, Richard slightly better than Samantha, but because you both know me, could you release my trauma? Or would the familiarity and all the content that you have that's preloaded into your mind interfere with an ability to connect? For instance, if I have a trauma, would you two people be able to help me with that trauma? Because if you can help me, you can help anyone, right? You knew where I was going with that.
I think we could.
Yeah, me too. Look, the body doesn't lie.
That's, yeah. Because
the body's going to give us the information, and the other ingredient, you know, at risk of sounding really sappy, the other ingredient is love.
I got my tissue box here. It's okay.
Yeah, but I don't see any tissues, Mark. What did you do?
I used them all up.
You used them all up. No, there's a loving energy in the room, and you know that, and I think that will supersede. Now, look, if I don't have to like a person to work with them, but it helps.
You seem to like most of your people.
Oh, I do. I do. And
I think he's just referring to conflict at the office. We'll get through it.
I don't have conflict with Mark. Mark is like one of my oldest and dearest friends, and a more loyal friend I don't know that I've ever had.
Ditto.
The question of
I feel the same way about you, Rick.
Well, okay, you'll get my check.
Rich.
The question of who does it help? I think that it's really great for trauma stuff.
Mm-hmm.
And I don't know, I haven't worked with have you worked with brain injury people, Sam?
I have. I've worked with some minor stuff, and I've worked with some very major stuff on a lymphatic level. Someone who's actually nonverbal, not on the level that we do, but I would receive it was very interesting working with him because he couldn't communicate, but he would communicate with me. And sometimes his body would communicate with me, and sometimes I would notice movements and color change, and his, he would get angry, he would get red. But someone who wasn't supposed to have any emotion or any feeling left, who was literally just a vegetable, working with him lymphatically. It was really interesting because I could tell that he didn't really like his wife very much, and I could feel different emotion. I could feel his emotions on a lymphatic level, and the way that he would move his body when she was around. So that was about the most interesting thing I ever had my hands in, until you and I started working together. This is even more interesting than that.
Well, because the dialogue part of this would be difficult, I would think, depending on where the brain injury was.
Yeah.
But it does occur to me that, look, the idea that mind and body are going to be involved in most emotional healing, to me, is 1 + 1 is 2.
Yeah.
The only question is, how do you do it, not if you do it.
Yeah.
So what's the future of this type of therapy?
I would say the future is that Sam and I are going to start training people and create an army of people to do this.
So it could be creating armies and training. Are there additional elements that you both have sometimes talked about that, maybe even a third person providing another level of insight? I imagine that the opportunities are endless. But
am I still with you guys? I think something happened here.
I think you're shamelessly promoting your name, Rich. Get back in here.
No. That's the problem with the phone is that people interrupt, and then I can't see the screen, and I tried to get rid of it, and I went to a different screen.
There's a little icon. It's a little moon. It's called "Do Not Disturb."
Ooh, there you go. Well, see, I'm very open to learning. I'm not. Details escape me a lot. You might have noticed.
No,
I think the future is that, number one, if we can document that this helps in cases that people feel are irreparable. We welcome cases that people think they can't be helped.
Mm-hmm.
Okay, that's
and as I'll shamelessly promote my book, because I wrote about this, but there's so much more to communicate, and probably be writing more and teaching. I think that Sam got my model, and she had it before I met her, I'm sure. 1 + 1 is 2. You got to have the mind and the body, and it's better if it happens in the moment. I don't know, I don't know. Want to comment on that, Sam?
And I could, going back to Mark's question, is like, do we pull a third person in? How, like, what does it look like? Other elements. I can already think of people that I know that I would like to start training in this. And it might not be a third person in the room, but it might be, I think this person could help you with this piece of it. So I want to put you over here with her, and then kind of come back to us. And so that we could either find a therapist and tailor it to that person's needs, or to be able to create like a village of people to help in different aspects. I've got one fabulous girlfriend who works like I do, and she's actually, Richard met her a couple of weeks ago, Crystal, we call her Fireheart, and she specializes in movement. And so she moves energy on a physical level.
Wow,
too.
okay.
So that's kind of movement that I want to bring.
I have another theory here to actually piggyback on that. I think a third person who brings another database in the room,
right,
can open up all kinds of things. I could see a situation, Mark, where you would be in the room with all your medical knowledge and knowledge of nutrition and other things that and Samantha touching the body would get more information because that other database is literally in the room.
Mm-hmm.
And this is kind of a theory I have about the way these things work. I would love to test it out at some point.
I would love to test it out as well. And the reason that now that I was asking is because I was looking for another job, and I thought I'd be the perfect candidate. We got an LMT, we got a PhD. Why not an MD? No,
Sure.
but it's
A lot of letters.
if you realize how
Alphabet
many directions you can go with this, and how, like you were saying, Samantha, you can fine tune this. It's really fascinating, and I'd like to thank you all for being here. Our most special guests, of course, Samantha Haynes and Dr. Richard Schulman.
And Dr. Mark Sylvester.
And
I just want to tell you guys, I worked with Samantha yesterday, and it was home runs all day long. And I got feedback from patients this morning about how powerful they felt the therapy was. I haven't had a chance to talk to you about it yet, Sam, but we got 2 people called me up this morning to tell me how powerful the work was.
And how badly it is needed, as evidenced by that.
Especially right
So
now.
we're going to be doing that at our practice. We're going to hope that people are learning about it, and hopefully this video taught you a little bit more about really the whole mind-body therapy and what that means when the rubber hits the road, the ins and outs and what have you, and the future of it as well. So I want you to join us next week because we have a surprise guest.
And how surprising is it?
It's a surprise because I haven't chosen one yet.
Okay. Well, it's a surprise to me too.
It's a surprise because I don't know for sure if she's going to be ready, and we might have to use the backup, and my marketing people wouldn't let me say her name. Wait, what? I wasn't supposed to say that? Okay, I wasn't supposed to say that. You'll find out next week. It's part of the mystique. You're going to have to watch episode 10. That's all today.
Thank you,
as
Sam.
always,
It was great to have you with us.
Thank you for having me. It was great to be here.
Okay.
And as always, be well.
Be well.